in functional medicine, we're really going beyond the traditional diagnosis treatment and looking at the very holistic approach to these issues with each patient on a very personalized basis, working to find that special combination of treatments and protocols that helps them reach an ultimate better place of health. I think that in functional medicine, again, we're looking at that more holistic, deeper root cause for things such as irritable bowel syndrome. We would not just typically do medications that would just treat the symptoms. We're diving deeper into that situation, looking at if there's a disorder of the gut microbiome, and trying to decide really what's that bigger picture, not just covering up the symptoms. And I think that's a critical part of functional medicine in how we do. We're not just about treating symptoms, really diving deeper into these issues of understanding the whole picture and also bringing into the more holistic or fully holistic approach of what's going on mentally, emotionally, and how those all tie in together to get a better state of treatment and understanding for each diagnosis. Thyroid problems, we tend to not just look at a few numbers, we typically look at a more expanded panel of laboratory studies and really look at those in the context of how a person is doing functionally, not just a number that we're trying to treat as a goal. We're really looking at that number, and I think this is very important in patients that we see with thyroid, not just a given number, quote, in the normal range, but that number relative to the symptoms or the state of health that that patient's in. A certain number may be perfect for one patient on their thyroid test, and yet for another that may represent significant hypothyroid condition in terms of their symptoms. And I think that's true with diabetes, another common metabolic disorder, where we're really looking at not just a simple sugar control or medication. We're looking at the interplay of lifestyle, genetics, diet, in addition to whatever we do with supplements and medication. Really has to be this fully integrated, holistic, personalized approach as we do in functional medicine with all diagnoses to come up to, again, that most optimal place of improving health for each individual patient.